tumor lysis syndrome. And so when we're talking about especially more advanced or rapidly dividing or aggressive cancers, things like high-grade lymphomas, or other even things like AML or ALL with high blast counts, it can put you at risk for this. And if you think about the pathophysiology, what we're talking about here with tumor lysis syndrome is somebody has one of these malignancies, they start to get chemotherapy. And oftentimes, and Max, I'm not sure about when you would make this decision, but what I've seen, being in the ICU is that a patient will get admitted to the ICU at least for a day as they start chemotherapy. Because as you start to go in there with a blowtorch and kill cancer cells and the cells lyse and get destroyed, well, they release all of their contents. And in particular, this can set you up for really severe electrolyte imbalances, these spiking levels of things like phosphorus, potassium, uric acid, and other things.
That's a patient that is set up for possible tumor lysis syndrome that you need to be monitoring closely and thinking about the development of this as a potential complication. With TLS, we often think about both a laboratory criteria as well as a clinical diagnosis of TLS, where the laboratory criteria, you really are thinking about those specific laboratory derangements of uric acid greater than 8, potassium greater than 6, phosphorus greater than 4.5, and then calcium less than 7. So it's everything else is high and the calcium is low. And this is driven by cells dying and spilling their intracellular contents and leading to those laboratory derangements that you're picking up on, where a clinical diagnosis of TLS is all of those laboratory criteria. Well, really, you want 2 or more of those laboratory criteria, and then either elevated creatinine, so an acute kidney injury, or something like a cardiac arrhythmia, which is often driven by high potassium. People can have seizures or even death. And the combination of a laboratory changes plus the clinical diagnosis is often what we're worried about with the evolving TLS picture with these laboratory derangements, and is why when we see those changes in the uric acid, potassium, phos, we want to implement intervention early